now moving towards our next fire chat session. It's on future of remote healthcare in India. And joining us for the same, we have with us Mr. Lokesh Prasad, MD, AliveCor India.
So to begin with, I'll wish Mr. Lokesh Prasad to just brief AliveCor, and then probably we'll start some nice questions, because I'm supposed to really put him into a corner actually today in the evening.
All right. Thank you for inviting me here. So AliveCor in a nutshell is essentially a company that is focused on AI-led cardiac care. Oh, sorry. Okay, better. So our entire reason for existence is to provide AI-led cardiac care. Our focus is on providing remote ECG monitoring services from any place that a patient or a citizen might be at, whether at home, whether in a village, or whether in a hospital setting. So the idea is, can we give an accurate ECG analysis right on the phone or a tablet of anyone, and tell that person whether his or her heart rhythm is normal, or they have various kinds of arrhythmias like atrial fibrillation, like, that's the leading cause of stroke. And in case the ECG is not normal, can they share it with their service provider, with the medical professional at the click of a button? So in a nutshell, that's what we are all about, and exciting things happening in this space.
Excellent. Just to brief you out, the entire day we've been discussing about two parts, which, if I have to really anchor myself, one was COVID and COVID disruptions, and other is the disparity we have it in as to the two Indias, the India and the Bharat. I wanted to ask you about this is, I want to go beyond COVID. What actually impacted me in last year is very young, very enthusiastic, very fit celebrities had a sudden deaths. What actually do you feel such devices would bring a change in such saving such lives? That's what something which really, because COVID is something, an infective disease. We want to really focus on non-communicable diseases also.
Yeah, so I'm not a doctor, so don't want to comment on the medical aspects of what happened there with people who unfortunately succumbed.
But how do you think this device can really save the lives?
Absolutely. So, just imagine a situation where somebody is not feeling comfortable, has some palpitations, for example, and that person is not sure about whether he or she should go to a hospital or, what to do next. At the middle of the night, let's say 2 a.m., somebody starts feeling palpitations. Now, imagine if that person had a device at home, and they take their ECG, and the AI tells you right there on the phone that the ECG is not normal. Then you know that your next step is to talk to a doctor. A number of times, what happens is people delay this. They might not be feeling comfortable, but they're not taking the next step. Something like this, if they have it in their house or their society or their village, for that matter, will allow them easy access to making the next decision. And I think that's where we want to go, make it so easy and affordable for anybody in the country to be able to get that first level of care and know what next to do. So we're trying to bridge the time difference between an event and the next level of medical professional help.
So do you mean to say we have a challenges in urban, which probably Stemplus was trying to address upon, is the acute care, or Dr. Tehan was talking about the disparity of the how can we rely on the remote diagnosis on it? Do you think this emergency cares and remote cares would be actually been value added by really having such devices? What's the place there?
Absolutely. I'm glad you asked that question, because one of the most important things for a clinician is to be able to get accurate readings. How reliable is the reading that they get on their system, on their laptop, on their phone, whatever? So for us, what makes us really proud is the fact that we are the most clinically validated personal ECG device that's out there in the world. We are the only FDA cleared personal ECG device that exists, and we are in India now. Our sensitivity and specificity numbers are both in the 97% plus. So there is that confidence that a clinician gets when they see something coming out of our technology. And this is all AI led, like I was mentioning before. That gives them the confidence that this is something they can rely on. You spoke about Dr. Trehan. Vedanta has actually created a command center where all their patients are able to send their ECGs. A cardiologist is able to review those ECGs and is able to tell the patient what they should do next, whether it's okay, whether they should come to the hospital or they should run to an ER. So the ability of somebody sitting in a small town, for example, who doesn't have access to an ECG right there and then, is, I think, a huge value add and a game changer in what we are trying to do. Because, I mean, our health system is overburdened. The burden of cardiovascular disease, as you know, in India is probably the highest in the world. If we are able to give this technology in the hands of, let's say, every ASHA worker who's out there, can we do large scale screening at almost no cost? That is our idea. So once you do that, you can funnel the people with heart issues to a district hospital or a medical college, or tell them, hey, listen, you need to go and meet a specialist. And very importantly, showing a normal reading is as important as showing an abnormal reading.
Very true.
Because a false negative can be
Yeah, that's what Dr. Tehan was actually
Yes.
addressing about.
And that's where, our specificity numbers of 98% plus, I mean, that's what we are really, really focused on. When we say normal, it has to mean normal.
Right.
So, there are 170 research papers that have been published in peer-reviewed journals, etc., about our technology. So we feel very confident when we go out there and tell people that, yes, you can trust our technology, our AI, our deep learning algorithms, etc. That is where we are coming from. So we're not launching something in the market which has not been clinically validated.
Right, got you. So, like you really nicely address the quality aspects. But, if I have to really look at my entire day, the major discussion which happened was on the skill differences. When we look at remote cares, when we look at even entire care system is concerned, how difficult is this device going to be? Is it like, I mean to ask you, like when you address ASHA workers, is it going to be easy for ASHA worker to use an ECG machine? And what if she makes an error and there is an error of diagnosis? So I would like to really have your couple of words on it.
Yeah, very important. So, typically, I'm guessing a lot of us have taken ECGs as part of our annual checkups or whatever. So you lie down, you got a bunch of wires and leads placed all over your body, and then a technician looks at the report. It goes to a doctor, etc. So you have this whole chain of events. You spend 30 minutes getting your ECG done. Instead of telling you how easy or how difficult it is, why don't I show you a quick video?
I would love to.
Of how this works and how there is absolutely almost zero training required for anybody to take an ECG.
Right. Can we
play the video, Abhishek? So pretty simple, right?
Yeah, it's pretty impressive actually. So I'm going to have one. By the way, Abhishek has sent it. I need to learn it. So,
No learning required. We just need to know how to hold the device in your hand.
uh,
That's it.
okay, so rather I should learn how to hold it. Um, what do you think would be, because this would need quite an behavioral changes. What do you think is a challenge as in mass acceptance or clinical acceptance or acceptance by physicians? How do you see that as a challenge for you people, or how do you try to overcome those challenges?
Yeah. So on the clinical side, I think the good news is that when we talk to the cardiologists, for example, they when they get to understand what this device can do for them or what this technology can do for them, I think the acceptance level is pretty high. I think the important thing is obviously they need to figure out what are the best use cases. In what patients does this make sense? So that's a decision that the clinician obviously has to make for themselves. But when they get to know the kind of background, the clinical research, the validation, etc., I think the good news on for us is there is a huge amount of acceptance on the clinical side. On the patient or the individual side, I think it's a question of awareness. Most people, I don't know how many people in this room, for example, know that this kind of a technology exists. And I think that's where we need, as AliveCor, to bridge that gap. We need to get better awareness going in the market. There is also a question of inertia. Do I really need this at home, even though affordability is not an issue? And we know that we were talking about COVID, right? I mean, how many people had pulse oximeters at home? Probably, I don't know, 5%, 10%. Now everybody has one. I think it's a question of awareness. It's a question of inertia. And the fact that most people might not even know what kind of silent cardiac issues they might be facing. I mean, 30% of India has some kind of cardiac issues. So we obviously need to do work on getting this awareness going and educate our population on how important it is to take care of your cardiac health.
Right. So good you brought out the point of the end users are there. And probably I would ask you the same question. I am wearing an Apple Watch. Why would I really go and invest one more thing? My Apple is giving me enough of my EKGs and ECGs. Why should I invest more? Why should I really get something more going on? Because, adding up more devices, again, which Vidhu said, adding up more apps, and somebody really argued, why more apps? Right? It eventually leads into lots of confusion. So why more? Why should I restrict to, or why should I go to it? Why would someone go for it?
Yeah. So an Apple Watch, for example, gives you a single lead ECG reading, and Apple also has an FDA clearance. We know that. Cardia 6L gives you 6 leads. 6 is better than 1, and most cardiologists look for lead 2, which is on the limb lead side. That's probably the most important lead for them, which we are able to provide. And we are not positioned as a lifestyle wearable. We are a proper medical grade ECG company. So our positioning is very different from somebody like an Apple. The other thing is an Apple is a personal device. If you are wearing your watch, it's really you who can, take your ECG. In our case, let's say you have 4 members in your family, everybody has their app, the Kardia app. Anybody can use our device and take their ECG and share it with their doctor. So there is no restriction. There is no issue about how many people can use one device, etc., which could be the case with wearables as we know of them today. So yeah, we are not positioned as a lifestyle device. We are a proper medical science company. And the amount of information that a doctor, a cardiologist is able to get from 6 leads is obviously much, much more than a single lead. Plus, I think the other differentiator is the number of cardiac issues that our AI is able to give you is way more than anybody else. Right now, we can give you 6 different arrhythmias on your phone. And I think that is a huge benefit for a patient and the doctor, both.
So we've been talking about the mass acceptance, and this is all about remote monitoring systems. What are the challenges you'll face it in probably acceptance in rural? I'll give you a background. So before that, so when I moved to India, so being practicing 20 years in US and then moved to a management side and the consulting side, as you know that, I have realized coming back to India, the major challenge has been the two Indias. The product that works sometimes in the city may not be the rural part. How do you think that rural part acceptance would happen, and what are the challenges you may face, especially for the rural monitoring is concerned? And where would you place yourself? Would you prefer to have at-home services, uh, out of hospital services, or probably something which is again a clinic services? What is the kind of strategic planning you're planning to do so?
So I think my answer is it's all of the above. So for example, in a small town, in a village, let's say tier 2, tier 3 city where you don't have access to a cardiologist, you might not even have access to an ECG. Now, what if we are able to give a general practitioner or a nurse or a technician a device in their hands? And anybody who comes into that clinic gets an ECG done.
Mhm.
Simple, 30 seconds, costs hardly anything. Versus somebody having to go to the nearest city, getting their ECG, losing a full days of income, spending one day on the road, etc., etc. And these are real
Do you mean to say
situations.
you're losing on the golden period of time to
Yeah,
survive?
could be,
Right. Mhm.
could be. We don't, I mean, that is a possibility, right? Because like I said, people are not aware. People don't know what to do. People have inertia of, it's okay, it'll go away kind of stuff. But what if this makes it so simple for either the local doctor? Now, there are issues about, somebody was talking earlier in the earlier session about what is the ability of a local physician or a nurse to even interpret an ECG?
Right.
It's low. Now, if I give you an AI engine in your hand that tells you whether your heart rhythm is normal or you need attention, I think that's a huge benefit. And our idea is not just to focus on the large cities, but because access there is available, but we really want to go into the tier 2, tier 3 villages, etc., where access is an issue and people really have no knowledge or awareness about what they can do. But if they know that, hey, listen, I can get my ECG done in my primary healthcare center, then that makes life easier for everybody. And hopefully we can save lives through that.
So you mean to say, as Vidhu said, computerizations of the EKGs or ECGs? Is it something like computerization of radiology, computerization of diagnostic? Will it help out of hospital care? Will it help the entire ecosystem of remote monitorings or entire delivery models designing changes? How do you see it as the entire ecosystem is concerned?
Yes, partially yes, like Vidur said, computerization of cardiac care. The other is obviously it's a huge productivity enhancement tool for cardiologists. If they don't need to call a patient to their clinic necessarily or the hospital, and the patient sitting in a small town is able to share their ECG with them at the click of a button from their phone, that's a huge benefit for the health system, which is anyways overloaded in any case. So what we want to position ourselves is yes, there is a variety of things that our AI can do, and we keep enhancing that every day. But what we cannot do, at least show that as abnormal, and therefore get that to the cardiologist or the physician who's taking care of the patient. So that's our idea. Eventually create a system where there is AI that's supporting you and put a productivity enhancement tool in the hands of the physicians.
Right. So if any step further from just an EKG something, because this is absolutely loving to me, actually. If I was to invest in something, I would be investing on this. So is it something like any more advances you're planning to?
Yes.
Whether it would be product or service based, what are the advances you're planning
Yeah, I
to?
think that's an important one. Yes, yes on both. And I can't talk about the advancements but some very interesting
Yeah, you can
developments
just give
happening.
us a vague figure how things are going to be
I
for
think in the
us
next
tomorrow.
in the next 2 months, you'll see a new product being launched in India, which is a credit card sized ECG device. We're launching that in Q2 of this year. So somewhere April, May timeframe. And then there are a couple of very, very interesting devices that we'll be launching in the next 6 to 18 months that obviously, you'll get access to as soon as they land in India. On the service provisioning side, very important question you asked, Dr. Tapan, is, let's say in the middle of the night, I get an abnormal ECG. What do I do?
Exactly.
And that's where the service model, it becomes very important. Now, in the US, we've launched something called KardiaCare, which gives you access to a cardiologist right there and then. We are working on building a similar model in India,
Okay.
where we will provide patients access to a cardiology service if they want their ECG to be reviewed and get the next level of advice.
Right.
So yes, that's coming. That's coming very soon.
So before my time ends, are you going to really solve all of this problem? That's what I'm looking at, something to deliver your cardiac care is concerned, right? From out of hospital to skill to disparity of qualities and everything.
I think we can definitely give you peace of mind. I don't think we can solve everybody's problems, but as far as peace of mind and the ability to check your heart health anytime, anywhere, yes, that's exactly what we are aiming to do.
Thank you, Lokesh. Thank you so much. Thank you, all of you. Thanks for being patient about it. Thank you.
Thank you.